So a bunion is essentially a growth or prominence on the inside of your foot, right on the side of the big toe that we can see here. Usually this is something that's progressive and gets worse over time. Usually causes irritation in certain shoes, especially more narrow shoes. Pain from that bunion usually causes some inflammation, or what we call a bursitis, on the inside of the big toe, which is usually what brings patients in to see us. We then usually diagnose this with x-ray and clinical exam to see the severity of the bunion in order to discuss how we will further treat that bunion. Here at Garden State Pain and Orthopedics, we do offer minimally invasive bunion surgery as well as corrective hammer toe surgery in order to straighten out the big toe as well as the lesser toes. We do this through several small percutaneous, or what we call portal incisions, which are about 1/8 of an inch, several small poke holes over the prominence and further up in the foot. And through this, we are able to shift the bone back so that the toe is straight and aligned. The minimally invasive approach allows the patient to be weight bearing immediately after surgery. We usually have them weight bearing for about 2 weeks in this protective boot in order to protect the surgical site. And from there, we usually transition them into a surgical shoe for about 2 weeks until at the 4-week mark, we take repeat x-rays, and assuming everything looks good, we have the patient transition back into a supportive athletic sneaker. Generally, what I tell patients is your body will tell you when you're ready for surgery. Something such as a bunion or hammer toes or any pain in general, if it's something that affects you daily and affects your daily activities, your walking, the shoes that you wear, then to me, that is your body telling you that it is time to get that fixed and taken care of so that you can really take advantage of your daily activities.
What are some common hesitations you find when people are not getting their bunion surgery?
So the most common hesitations that I see when it comes to bunion surgery are patients who may know a friend of a friend who had a bunion surgery that they said was so painful, or that they were off their foot for 6 to 12 weeks, they were in a cast. It's great at Garden State Pain and Orthopedics, the surgery that we offer is a minimally invasive bunion surgery, which allows a patient to be walking the day of their surgery, usually in a protective boot for several weeks, followed by a protective shoe for a few weeks, so that the patient could then be back into a sneaker by 4 weeks from the day of their surgery, and back to full activity 10 to 12 weeks from the day of the surgery. We usually find that there's less swelling, significantly less scarring, since this is done through a poke hole stab incision on the foot compared to a traditional large incision that's done with previous surgery. So usually I tell patients that the recovery is very different compared to the traditional open approaches that we've seen previously.